I actually feel really offended when people say that the person who died, they had an underlying medical condition. I've had an underlying medical condition for 47 years now.
You're seeing a community that's very angry, and they're also very concerned with the lack of care that's coming from our leadership.
People with disabilities are really feeling left out.
Carolyn Campbell-McLean lives with spinal muscular atrophy, and life is near impossible without proper support.
Oh, so muggy. Look at it. It's going to pour again. There were times over the New Year's period where I didn't have a shower for days. I didn't know when my next toilet stop was happening or if I could cook a meal that night.
The federal government doesn't publish how many Australians who died from COVID had a disability, but UK figures estimate it's around 60%. For people who work within the sector, like River Knight, that's a tragedy.
So when we have our leaders say we need to live with it, people who have a disability, who have underlying health conditions, are not going to live with it. They are potentially going to die from it.
At the start of the pandemic, the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability called for all states and territories to protect and support those with disability.
I work with the 10,000 registered service providers, the 30,000 unregistered service providers, and the 500,000 participants around Australia. And I'm not aware of any consultation that has happened between the government and the sector.
They just seem to have forgotten about us and let it rip.
Sue Greer is mother to a 36-year-old with Down syndrome.
But you can't go and see Kelly today, mate. It's too dangerous. Can't get you getting sick.
She also runs a support coordination service in Queensland and is critical of the Palaszczuk government.
It's all crumbling down because the government never set everything up for this border opening.
Her biggest concern, access to rapid antigen and PCR tests, something carers all around Australia are struggling with.
I want to be able to see us get hold of tests a lot quicker.
Even as service providers, we can't actually find the RAT tests quickly. We can't get a hold of them for testing our staff.
With the disabled at higher risk of serious complications from COVID, surveillance testing is essential. Back in Sydney, Carolyn and her husband have spent more than $1,300 of their own money on RAT tests.
I'm lucky I've been able to access them, but other people I know haven't got them, and so they're having support workers come in and shower them, and they don't know whether they've got COVID or not, and that's just not okay. I think we've got a couple more boxes, but I really should be starting to look for some more.
In Brisbane, Tony has been battling COVID. This is her first day out of isolation. For more than a week, she's not been able to care for her 31-year-old client with cerebral palsy.
I'm the senior support worker for that house, so I'm his main carer, and he's feeling the punch with me not being there.
Tony has 2 special needs children, which means long queues for PCR tests are problematic.
My daughter, who's 13, she has the offensive side of Tourette's, and we're in line and she's yelling out, "I've got COVID, we've all got COVID," and some more offensive language that I can't repeat.
We need to have a priority system. So if I'm an essential service worker, if I'm a person who has 24-hour care or requires staff or has underlying health conditions, there needs to be a clear priority that I'm not going to sit there in line for 3 hours with a lot of people that may or may not have COVID to get tested.
Our participants at work, they would not be able to even handle half an hour, let alone 3, 4, 5 hours, and some people are waiting 10 hours in line.
RAT tests might not be the gold standard, but disability workers believe they can be an important tool and should be free.
I'm happy for my taxes to go to the free tests.
Sadly, the consensus is that the situation is going to get worse before it gets better.
It's been so prevalent, carers' families are getting it, carers are getting it. We feel like we're kind of sitting ducks, unfortunately.
We're talking about catastrophic failure of service providers being able to support high-intensity participants with medical support needs. We're talking about participants with medical support needs who have difficulty breathing already, who will pass away if they are exposed to and contract COVID, because they are the cohort who's highest at risk.
I've had my days, yeah, absolutely. I think we're all going through ups and downs with mental health at the moment. There was one day where I drove up the street in my wheelchair and I screamed out loud in the air, and I just went, oh, I don't know how much more we can take. You know, I think that our society should be judged by the way it treats people with disabilities and older people and people who are vulnerable. And I don't think we're doing a very good job of that at the moment.
That is so very true. Of the many tragedies that have existed throughout this pandemic, the way we're treating our disabled is exactly that,